Hi everyone. As we indulge into a clinical day and we have already discussed few clinical sessions, so now we will continue with our next session with an introduction. Let's just imagine a complex, efficient system within our body working round the clock to filter toxins and excess substances. Now, let's first understand the objective of the session. So, here we are going to explore the urinary system anatomy, physiology, and related diseases so that dietitians will understand the structure and functions of the urinary system and will be able to plan tailored dietary recommendations for the clients with kidney issues. So stay tuned as we delve deeper into the anatomy of the urinary system. The urinary system is a complex network of organs, each playing a crucial role. It is made up of 4 components: the kidneys, ureters, bladder, and urethra. Kidneys are bean-shaped organs about 11 cm long, 6 cm wide, 3 cm thick, and weigh 150 grams. Now let's understand the functions of kidneys. Kidneys are the superstars of urinary system, filtering out waste products and excess substances from the blood. Kidney is also an endocrine gland which secretes enzymes renin, 1,2,5-dihydroxycholecalciferol, and erythropoietin. It is an enzyme secreted by cells of juxtaglomerular apparatus which helps in regulation of blood pressure. 1,2,5-dihydroxycholecalciferol is a biological active form of vitamin D3 found in kidney. Kidney is essential for RBC formation, which is called as erythropoietin. Kidney regulate osmotic pressure in the body by regulating fluids and electrolyte balance called osmoregulation. Kidney also regulates pH balance called homeostasis. Metabolic waste of the body are excreted in the form of urea, creatinine, uric acid, drugs, toxins, etc. in urine. Next function is selective reabsorption of glucose, amino acids, water, and electrolytes in the renal tubules. As you can see, each component of the urinary system is essential for its proper functioning. But what happens when the kidneys can't perform these vital functions? Let's talk about urinary tract infection first. UTI is an infection in any part of the urinary system in the kidneys, bladder, or urethra. Urinary tract infections are more common in women. They usually occur in the bladder or urethra, but more serious infections involve the kidney. UTI is usually caused by E. coli bacteria, which is a type of bacteria commonly found in the gastrointestinal tract. Next is symptoms. UTI don't always cause symptoms. When they do, they may include a strong urge to urinate that doesn't go away. Second, burning feeling when urinating, often urinating and passing small amounts of urine. Urine that looks cloudy and urine that appears red, bright pink or cola colored. Red color appearance is the sign of blood in the urine. In this case, always recommend your client to meet the doctor because it may cause severe problems. The last one is strong smelling urine and pelvic pain in women, especially in the center of the pelvis and around the area of the pubic bone. For those symptoms which we have discussed, doctor recommend the following test, and by analysis these tests, a dietitian can check the severity levels and provide diet accordingly. Urine analysis. In this test, dietitian must check the WBC count. Increased WBC is the sign of infection in urine. And also the color, appearance, pH of the urine. Normal urine pH is slightly acidic with usual values of 5.5 to 7.5. But the normal range is 4.5 to 8.0. And ultrasonography is the another way to detect the UTI in particular part of urinary system. Now, there are some preventive measures which a dietitian can guide to the clients, such as drinking plenty of liquids, especially water. Drinking water helps to dilute the urine, allow the bacteria to be flushed from the urinary tract before an infection can begin. You can also try cranberry juice. Studies that look into whether cranberry juice prevents UTIs aren't final. However, drinking cranberry juice is likely not harmful. Next prevention which a dietitian can explain is wiping the urethra from front to back. Do this after urinating and after a bowel movement. It helps prevent the spread of bacteria from the anus to the vagina and urethra. Also, drink a full glass of water to help flush bacteria. Avoid potentially irritating feminine products. Using these products in the genital area can irritate the urethra. These products include deodorant sprays, touches, and powders. Also, there are some home remedies which help to reduce the severity of urinary tract infections, such as mint water, fennel water, and oversoaked raisins. On the basis of what we have learnt above, dietitian can include berries. Although researchers are still studying their effectiveness, it is believed that eating cranberries, blueberries, and raspberries can help fight off a UTI. For non-diabetic, mix 15 ml cranberry juice in 30 ml of water as the patient is in weight reduction. They contain proanthocyanidin, which has been shown to prevent infection-causing bacteria from adhering to the lining of the urinary tract. Dietitian can incorporating probiotic-rich foods like plain Greek yogurt, pickles, and sauerkraut into your diet since they contain good bacteria that can help combat infection. Taking oral probiotics actually changes the flora of the vagina. Next, foods that are rich in fiber such as bananas, beans, lentils, nuts, oats, and other whole grains can help remove harmful bacteria from your body. They also encourage regular bowel movements, which can help relieve some bladder pressure. A dietitian can plan cold water fish contain omega-3 fatty acids, which can help reduce inflammation caused by a UTI. Fish oil. Supplements are another great alternative for individuals who do not eat fish. But always consult your doctor before adding any supplements to your diet. You can also plan detox water such as apple cider vinegar in lukewarm water because it is antibacterial. Lemon water without sugar is also a great alternative. Drinking ginger juice or ginger tea can be effective in treating UTIs. Add cucumber in diet as it is a natural diuretic. Mix 3-4 slices of cucumber and 3-4 slices of mint in 1 liter of water and consume it periodically in a day. When we talk about UTI, citrus fruit plays important role. They are considered to be a part of the extra health benefits group of fruits. This is due to the high vitamin C content of these fruits. Vitamin C boosts overall immunity of the body and that protects you from the urinary tract infections. Vitamin C increases the acid levels in your urine, thereby killing harmful bacteria. Regular consumption of citrus fruits is strongly linked to a lower risk of UTIs. Even protein is critical to support the immune system and regulate blood sugar rise. When planning a meal, always put 15 to 30 grams of plant protein on your plate if feasible. Avoid following in UTIs such as carbohydrate, soda, alcohol like beer, wine and liquor, artificial sweeteners and spicy foods. Sugar is laced in an overwhelming amount of commercial foods and drinks these days. Unfortunately, it can also aggravate an infection. We hope this session gives you the clear picture of urinary tract infection, and next disease we will cover in upcoming video. Urinary tract infection. Let's delve into another disease of urinary system, that is kidney stones. In this video, we will cover kidney stones and chronic kidney disease. So first, start with kidney stones. A kidney stone is a hard object that is made from chemicals in the urine. After formation, the stone may stay in the kidney or travel down the urinary tract into the ureter. Stones that don't move may cause a backup of urine, which causes pain. There are 4 different types of kidney stones. First is calcium oxalate stones. They are very common and created when calcium combines with oxalate in the urine. Second is uric acid stones. They are common and caused by high purine intake, leading to monosodium urate production. Third type is true white stones. They are less common, caused by infections in the upper urinary tract. And last is cystine stones. They are rare and tend to run in families with a history of cystinuria. Now, you must be thinking, what are the main risk factors of kidney stones? So if you or a family member has had kidney stones, you are more likely to develop a stone. Excessive sweating or not drinking enough water can increase your risk for kidney stones. Diets high in purine, salt, protein or sugar increases your risk for certain types of stones. Next is obesity. Obesity has linked to an increased risk of kidney stone, and even surgeries which can change your digestive system can affect absorption of calcium and water, increasing the concentration of stone formation substances in your urine. Other medical conditions such as high blood pressure, diabetes and cystinuria may increase the risk of kidney stones. Let's come and imaging tests. In imaging test, your doctor will want to know the exact shape and size of the stone. This can be done with a high-resolution CT scan. Other imaging options may include a KUB X-ray or an intravenous pyelogram. And urine testing. The doctor may also ask that you collect your urine for 24 hours to test for levels of stone-forming minerals and stone-preventing substances. Blood testing. Doctor will test your blood for calcium, phosphorus and uric acid. Stone analysis. The stone will be analyzed after it comes out of your body in order to determine cause and a plan for prevention. Let's talk about the symptoms of kidney stone. Severe pain on either side of your lower back, more vague pain or stomach ache that doesn't go away, blood in the urine, nausea or vomiting, fever and chills, urine that smells bad or looks cloudy. After getting the symptoms, let's move on to our next slide of diagnosis. Appendicitis and UTI again have the same symptoms as kidney stones. but it can be diagnosed with some tests such as ultrasonography. Now, after the disease condition, let's talk about how dietitian can plan the diet. A dietitian can include ginger, cucumber, lemon, coconut water, strawberries, celery juice, pomegranate juice, capsicum, carrots, buttermilk, watermelon. And the food items which dietitian should not include are whole pulses, nuts such as like peanuts, cashew, spinach, raw tomatoes, mushrooms, brinjals, dark green leafy vegetables and tomato soup. They can consume low oxalate foods. Oxalate is found in almost all plant foods. However, it is concentrated in a few. Spinach and almonds are just a few of the options. It is rarely essential to totally eliminate oxalate containing items from your diet. This must be assessed on an individual basis and is dependent on the cause of your excessive oxalate levels. The ideal diet for preventing kidney stones centers around maintaining a balanced intake of essential nutrients while strategically avoiding certain foods. Vegetables provides valuable vitamins and minerals without overwhelming the system with excessive oxalates or sodium. Adequate calcium intake from dietary sources rather than supplements can help bind oxalates in the intestines, mitigating their absorption and reduce the risk of stone development. We still see patients who wonder why they are getting recurring stones despite cutting down on their calcium intake. Even we had patients say that their doctors told them to reduce their calcium intake. A diet low in calcium actually increases one's risk of developing kidney stones. Don't reduce the calcium. Work to cut back on sodium in your diet and to pair calcium-rich foods with oxalate-rich foods. Now, the third important disease which we will be discussing is chronic kidney disease. So what is CKD? It is a condition characterized by a gradual loss of kidney function. Early stages can be asymptomatic. Disease progression occurs slowly over a period of time. There are some symptoms a client may experience such as poor appetite, weight loss, muscle cramps, nausea, loss of appetite, fatigue, edema. Edema is the swelling of feet and ankle. A client may experience high blood pressure and also needs to urinate more often, especially at night. Decreased mental sharpness, problems with sleep, and protein in urine, which is called proteinuria, are the other symptoms of chronic kidney disease. Also, erectile dysfunction in men or twitching in the muscles and cramps are common. Now, we will discuss the severe symptoms a client may experience such as fluid builds up around the lining of heart and lungs. Shortness of breath. The last symptoms is hematuria, that is blood in urine. So in these conditions, always connect with your doctor. Diagnosis of chronic kidney disease starts by analyzing medical history and family history. Doctor may also check for medications which could have caused damage to the kidneys. Dietitian can check urine tests to check for abnormalities such as the presence of blood or protein. Ultrasound is done to look for structure abnormalities in the kidney. Hormone test, like levels of parathyroid hormone, is measured which is affected by kidney function. And the last one is kidney biopsy. So after diagnostic evaluation, we will understand the stages of CKD. And to understand the stages of CKD, you must know what is EGFR. EGFR, estimated glomerular filtration rate, it shows how well kidney filtrate the blood. As As you can see the picture that shows the stages of CKD, here there are 5 stages of CKD, like stage 1 of CKD, where eGFR is 90 or greater. Stage 2 of CKD, where eGFR is between 60 and 89. Stage 3 of CKD shows eGFR is between 45 and 59. Stage 3 of CKD shows eGFR is between 30 and 44. Stage 4 of CKD, eGFR between 15 and 29. Stage 5 of CKD, eGFR less than 15. Both stage 4 and stage 5 are close where kidney is not working. And in Fitello, we are only considering cases of stage 1 and 2 where kidney damage is low. Including many convenience foods such as frozen food, canned foods and fast foods. Next is, lower the amount of potassium when your kidneys are not working well. Your potassium level may be too high or too low. Having too much or too little potassium can cause muscle cramps, problems with the way your heart beats and muscle weakness. So, you can avoid high potassium foods such as bananas, oranges, potatoes, spinach and tomatoes. You can include low potassium foods such as apples, cabbage, carrots, green beans, grapes and strawberries. You can limit protein content such as meats, eggs, milk, cheese and beans, and can go for low protein diets such as vegetables, fruits, breads and cereals. You can control your portion sizes of packaged food such as the nutrition facts label to learn the serving size and how much of each nutrient is in one serving. Many packages have more than one serving. For example, a 20-ounce bottle of soda is really 2.5 servings. For fresh foods that do not have nutrition facts label, such as fruits and vegetables, ask your dietitian for a list of nutrition facts to measure the right portions. Eat slowly and stop eating when you are full. It takes 20 minutes for your stomach to tell your brain that you are full. If you eat too quickly, you may eat more than you need. Avoid eating while doing something else, such as watching TV or drive. With this, we have done with our 3 disease condition of urinary system. And next disease we will cover in next video.